Okay.
I'm Cynthia, and I'm from Auburn, Washington. And it was actually the YouTube things that really probably pulled me towards the decision to come here and have the surgery. In Washington, there really aren't a lot of people who have had the surgery. I really searched out to try to find someone who I could communicate with and sit down and talk with personally. The whole idea of doing the internet and finding those people online was awesome because they made all the difference for me. I couldn't find anybody in the Seattle area that wasn't already connected to some kind of a bariatric program there, and they were not positive about this. After my experience this week, I'm very positive about this. This was the right decision for me. I can tell you that I had very little, if any, complications whatsoever. I didn't even have the shoulder pain. Thank you very much for avoiding that nerve. I appreciate it. And getting up all night long, Jolene and I were roommates. We just...
Because your husband had all those questions.
We went in and out of that bathroom like you wouldn't believe. But I will agree with her. I did not remember anything from the surgery. A little sore throat, you know, from the tube and that sort of thing. Just follow the directions that they give you. And then go a little bit farther probably, because that's what I did. You know, I ate the salt. I'll put it in my hand. I'll eat that. That's the only thing I've had is a little of that jittery feeling. And when I called, I know it was simply because I'm probably sodium deficient. So then I would dump the salt packets. I discovered hot and sour soup. Oh, man, that's great. Hot and sour soup, put 2 or 3 extra packets of soy sauce in there, and you're good to zip through the casinos and do the whole 9 yards. That's all you really need is that extra soy sauce. And we went to Blue Man Group. We went and saw that show. Gosh, my son showed up. My husband said that I waited to feel better until my son got here. He had to leave on Saturday. You know, but Nathan and I, we've been to the Mirage and the Luxor, and we've walked around all these casinos and done a lot of things. It is cooler in there, by the way. Although they do take your money. I figured that out. Bloody Mary Mix was really, really good. You can sit and play games. For those of you guys who are having the surgery this week, you know, I think getting out and walking around and doing that and just constantly moving, forcing myself to be back in to the kind of a thing that I'm going to do when I go home tomorrow. So when I get home tomorrow, I have a very busy schedule already set up, and I want to feel good about that. Little things, and these are horrible things to talk about on camera, but flatulence, tremendous amount for me. Now, I know some other people have said, no, not so much yet. But that's one of the things I would ask you, is there any way to stop that, for heaven's sakes, in my office, for example?
Well, you're getting it right now because you're taking so much in. You may be swallowing some air and things like that. But if you think of like hot and sour soup and salt and Gatorade and Bloody Mary Mix, there's not much that causes gas there. Now, your gut is brand new, and so that's going to adapt as your diet changes. Later on, you can have bad gas if you eat heavy or junky foods. So the way the surgery works is it impairs the digestion and absorption of fat. Remember, that's why people come to me in the first place, because they're good at digesting and absorbing fat. And they are, unfortunately, overwhelmed with too much fat. So our surgery intentionally blocks and interferes with the digestion and absorption of fat. That's good. That's why people lose so much weight, and we can see that. On the other hand, the disadvantage of not digesting and absorbing fat, it will stay in the gut. And if it stays in the gut, as it gets down to the colon, the bacteria that live normally in the colon will metabolize that fat into smelly gas. So the way to avoid it in the future is to have kind of a healthier, lighter diet. So fresh fruits and vegetables, avoiding some of the things that are known to cause gas in the vegetable line, such as beans and cruciferous vegetables like cabbage and cauliflower, will generally give you a light, very healthy diet that will have very little gas.
Well, and you know, along that line, one of the things that I did enjoy the other day was French onion soup. And onions, obviously, would probably...
The onions, and if you had any of the cheese on top.
No, I was afraid of that. The cheese scared me a little bit. I will say that in the Virgin Bloody Mary, They gave me 3 olives, and those were really good. I chewed them up really good.
Good.
They
Well,
were
there's a
very
little fat in
salty.
there, and
Yeah.
so right now your body is at its most impaired digestion and absorption, and so it's going to get better over time.
And I did ask for the patch, and I probably didn't need it. I wasn't feeling any kind of an emotional issue, but I was feeling that really shakiness. It feels like you've just had the flu and you are trying to recover, and yet you just don't have a lot of energy. So when I called, they said, well, maybe the patch would help, and I did use it, but I didn't have any of the emotional problems, no vomiting, no nausea, no serious pain. It's just, I think it's a wonderful, wonderful surgery, wonderful opportunity to have a tool to help you to accomplish what you want health-wise as well as physically. So.
Nipples out.
And you lost 9 pounds.
Oh, and I lost 9 pounds.
Yeah. So you got a tiny bruise there. You can get a bruising. Notice my hands never touch the patient. For all you internet critics.
Thank you very much.
Now that's all.